everyone, I'm Sarah with Arise Aesthetics and Wellness, and I wanted to just talk a little bit about bioidentical hormone replacement therapy. And a lot of people ask what BHRT is, or bioidentical hormone replacement therapy. The difference between that and synthetic hormones is that bioidentical hormones are chemically and molecularly identical to what your body makes. And that's important because your body sees it as something that it recognizes and is able to do something useful with it, versus synthetic hormones your body doesn't really recognize, and it can have unwanted side effects. Bioidentical hormone replacement therapy has been life-changing for many women and men, and we see success stories here on a daily basis. I have a lot of patients that will come to me and they will kind of feel like they're starting to begin to experience the effects of aging, right? They're starting to say things like, I don't have any more energy, I feel like I'm weak, I don't have any excitement for life anymore. We start to kind of take a look at their hormones and we realize that their levels are not optimal anymore. And that is something that happens with aging, but we don't have to experience a downward spiral that we saw in our parents and grandparents. Now we have the ability to replace those hormones to optimal levels. And when you do that, you can begin to experience more youthfulness. I have patients that come back to me and say, I feel like I did when I was in my 20s and 30s again. I have so much energy, I can keep up with my grandkids. Or they'll say things like, I feel like I'm stronger again. I don't have as much brain fog. I'm able to think clearly. And it can even improve the sex lives. And we know that that can make a big difference for a lot of people. So bioidentical hormones can be very safe. There are some things that we have to look at before we're able to get somebody onto hormones. We look at the health history, we look at things that they've experienced in life, but it can be a very safe option for a lot of people who want to restore their vitality and their vigor. When someone is looking at getting their hormones replaced, we of course want to look at their health history. We want to see what's been going on in their life. We want to take a look at the lab work. The hormones can include things like estrogen, progesterone, testosterone, even the thyroid hormone can sometimes need a little replacing, and so we will talk with the patient about some of the different options that we have, and it may be one or two hormones, it may be all the hormones that that person needs to have restored. We look at estrogen in women because it plays a big role actually in bone production, and we know that as we age we produce less and less estrogen, and then we see higher and higher rates of osteoporosis. Those go hand in hand, so oftentimes we replace the estrogen again to help with the bone building. We replace progesterone oftentimes for women who are saying that they are not sleeping well at night or they feel irritable. They're having hot flashes and night sweats. We can put progesterone back in. Testosterone is not just a hormone for men. It can be very helpful for women as well. And it doesn't just have to be the sexual part of it. It can be for increased motivation, increased mood, increased physical stamina. And then the thyroid hormone often gets overlooked, and that's too bad because the thyroid hormone does need to be replaced oftentimes, and that plays a big role in our metabolism and our energy levels. And converting our food into energy, and so oftentimes we look at that. One thing that I like to stress around here is at Arise Aesthetics and Wellness is that normal is not optimal, and so oftentimes people will come to me and they'll say, my doctor said everything looks normal on my labs, but I don't feel good or I don't feel well. And when I am able to dig a little bit deeper, we realize that normal is not optimal, and when we optimize hormones, then that's when people really start to truly feel better. Oftentimes I'll tell my patients to give it at least 6 to 12 weeks before they start noticing any difference, but usually it's much sooner than that. Usually at about a 2-week mark, patients are saying, I'm starting to notice I'm sleeping better, I'm in a much better mood. Even my husband has said, wow, you are in a much better mood. And so it actually can be a pretty quick turnaround. It's not the case for everybody, but oftentimes within a few weeks we're starting to notice a big difference from the hormone replacement therapy. If hormone replacement therapy sounds like something that you may be interested in, if you feel like you've kind of lost your luster for life, if you feel like you've lost your energy levels and you're looking for something to kind of restore your vitality, then give us a call. You can look online and book an appointment at Arise Aesthetics and Wellness. We are happy to help you.